On today's new notebook, we're talking about hair loss and what you can do about it. Joining me is Dr. Jerold Olson. Welcome, doctor.
Thank you.
Yeah, so there's a free event where people can learn more about hair loss treatment. We'll get to that in just a moment, but first, why is hair loss an important topic?
In the United States, there's approximately 50 million men and 30 million women who are affected by hair loss, affected enough that they spend about $130 million a year on hair loss products. No one's thrilled when this problem happens to them. And there are newer things that we can do about it now.
And what is new in the area of non-surgical treatments?
So, you know, we've had topical treatments like minoxidil that have been around for a long time that help to stabilize the hair that remains. But in the past few years, people have discovered that injecting a portion of the patient's own blood into the scalp can stimulate hair to regrow. Platelet-rich plasma has been used in orthopedic treatments for years. We isolate the platelet portion of the blood that contains growth factors, and by injecting that back into areas of the scalp that are thinning, you can actually stimulate new growth. It does not work for everybody, but for people who get a result, the results can be really dramatic.
Okay, and are there any advances in hair transplantation?
Well, a lot's happened over the past couple decades in hair transplantation. I mean, we all have an image of usually a man who had a really visible transplantation where the plugs were noticeable. So the tendency, the trend has been towards smaller grafts. Typically, those have been harvested by removing a part of the scalp, usually from the back of the head. The problem with that is you can often see that scar, especially if you're trying to wear your hair shorter, like many guys do. So now we're harvesting that hair in individual follicular units, which means 1 to 4 hairs. We use technology to do it now. We use a device called the NeoGraft, which allows us to harvest 1,500, 2,000, 2,200 grafts in a single session without leaving a long and noticeable scar.
All right, so technology has really come a long way.
It has.